Welcome to the GIH 2022 Annual Conference. I'm Kara James, and it really is my pleasure to see so many faces in the room in person, and we thank all of you who are joining us virtually. I especially want to thank all of you who have suffered the travel woes of flight today and this week to persevere and be in the room. We are super excited for the week ahead of us. We are gathering at a time of serious inflection for our country and for health philanthropy. And I think as you're going to see throughout the week in the conversations that we have, we're lifting a lot of those topics up. We're digging in to the serious issues that are ahead of us and working to figure out how do we all work together to achieve our goal of better health for all through better philanthropy. We are really excited to welcome over 200 new people, first-timers to the GIH conference. So our newcomers lunch that we just had, we had to bring in more chairs, which is great. We hope you will connect with others, connect with those ambassadors that we have, and really get to know us. And for those of you who don't know who we are, because we also have some other faces in the room that include our sponsors and those who are providing support to philanthropy organizations through academia and other areas. So you might see some other folks who are around who are not necessarily funders, but it's really important as we think about the work that we have ahead, how we are expanding our partnerships and collaborations across philanthropy and across multiple sectors to achieve our goals, because the problems we're trying to solve are not ones that can be solved by any one sector. So for those of you who may not know GIH like the rest of us, because this is my first in-person conference, super excited about that, but there are others who've been here for years. We are celebrating our 40th anniversary this year, and GIH has been gathering in-person conferences for health funders since the early 1990s. So just a show of hands, how many of you have been to more than 10 or 15, we'll say 10 GIH conferences in the past? How about 15? Got a few? And anybody 20? Oh, we got a couple, yes. Okay, so we got some prizes. So there have been people who have been with us for a long part of the journey, and we still have a lot of work to do. But as you can see, GIH and our mission is really to foster communication and collaboration among grant makers and others. And as you can see, we are working on a vision of better health for all through better philanthropy. As I said, this is our 40th anniversary. I am not going to go through all of the things that GIH has been doing throughout that time, but you can see some of the key points here in the small font, but I want to highlight some of the big ones. So GIH opens its doors. I know the newcomers now know this, but we opened our doors 40 years ago. We moved to DC in 1984. We incorporated and moved in 1991. And as I was saying to one of our speakers in preparation for this, I was reading some of the board minutes from some of those conversations about moving. And one of the questions was, you know, would it actually make a difference in terms of being closer to the policymakers and others who were in DC and some of the others who were involved in the work that we were doing? So we have been there. The 1990s also saw growth, as we talk about, in partnerships and collaborations. Our first public-private partnership with the Federal Office of Rural Health Policy and the National Rural Health Association to talk about rural health issues. We also started our first conversion survey and began hosting our GIH annual conferences. And we had a lot of work that we were doing in terms of the Terrence Keenan Award in Health Policy Leadership and others. Fast forward to the early 2000s and 2010s, work on the Affordable Care Act and helping to set up resources there, establishing the Andy Hyman Award, and now here we are 40 years later. We've launched our new strategic plan that we're going to talk about, and we are coming on the other side of what has been a clearly transformative past few years that we're still recovering from and have a lot of work to do. So what have we been doing since we last gathered in 2019? We have been focusing, and we've launched a new trustee website that has resources. We've put out another one of our conversion surveys. We've also worked on a climate toolkit with others in the philanthropy serving organizations. We also have had conversations with the new administration and ongoing work with other parts of the administration through CMS, USDA, HRSA, and others. We've been for 10 years co-hosting the Rural Philanthropy Meeting, which several of you were at a couple of weeks ago. That is in partnership with the Federal Office of Rural Health Policy, as well as the National Rural Health Association, and now the Centers for Disease Control and Prevention. We also just recently put out our funder approaches to youth behavioral health equity. And last November, during our fall forum, we had a focus on From Crisis to Care, decriminalizing mental illness and addiction. We also have just selected our new Terrence Keenan Institute Fellows, and I know a couple of them are here in the room, so where are you guys? If you want to raise your hand and let us know. We've got a couple over here, some over there, so we're, and back in the back. So we are really excited about the focus and thinking about the future of health philanthropy, who's doing the work, and how do we make sure that we have a robust and diverse group of experts who are helping to transform our health and health care. We've also been very focused on health equity. And this is not surprising. I mean, with the pandemic, everyone is now acutely aware of the inequities that we experience in our society. We've had conversations with CEO and staff. Many of you have hired individuals to focus on either diversity, equity, inclusion, or health equity, or both. It's been a time where we're all trying to figure out how do we really have an impact and move the needle so we're no longer just talking about some of the challenges or just highlighting some of the disparities that we see. We did a survey in 2020 to ask you what you were doing and how you were pivoting, and that has helped to guide our work since then. We knew a number of you were still trying to figure things out at that point in time. I think we're all still trying to figure some things out. It was also a focus area that we had in our fall forum this past November, and we produced 2 reports providing recommendations on how to improve our collection of race ethnicity data at the federal and state level. Because if we can't measure it, we can't monitor it, and we don't know if we're making progress on achieving our health disparity goals. And we are having a board survey on diversity. So that is something we are hoping all of you will fill out to help us understand what's going on and how you are pivoting within your organizations. And then in November, we launched our new strategic plan. And this was the work of a year-long focus to understand what we needed to be doing as we are all pivoting in these 40 years. One of the things that we did was to really incorporate that for all focus through health equity lens into our vision statement. And so you can see we are focused on better health for all through better philanthropy. The other thing that we're doing is we are concentrating our efforts in 5 focus areas. You'll see we've gone from the 12 issue areas down to 5. The reasoning for this is we look at these are the building blocks that we think are important to achieve better health for all through better philanthropy. Access and quality, community engagement and empowerment, health equity and social justice, philanthropic growth and impact, population health. It doesn't matter if you're working on oral health, rural health, behavioral health. We need to be thinking about what are the challenges that we have in access and quality? How do we improve the access to healthcare services and quality? How are we engaging those who are most affected by the goals of what we're trying to do? Making sure that their voice is at the table, that we're listening to them and doing work with them and not to them. Health equity and social justice, as well as our philanthropic growth and impact and population health. Where are those specific areas where we have challenges within those areas that we need to be paying attention to? We're working in 4 strategic pillars through our strategic plan. Our partner-centric approach. We are a philanthropy support organization. We always will be. making sure that we are taking your needs into consideration, understanding where you're having challenges and how we can help support you in achieving your goals, making sure we have that finger on the pulse of health philanthropy so that when people come to us, we can be that bridge and connector for you to your peers, for others to understand what health funders are doing. Being that hub of health philanthropy, again, the challenges that we are working on and that face us are not ones that any one sector can solve alone. So how do we build some of those bridges, connect with others, utilize, so we're working on cross-sector partnerships to advance all of our goals. The other one is our leadership and influence. And we appreciate those who participated in our focus group this morning and those who will be joining us tomorrow. This is a newer space for GIH. We've always been involved in policy and advocacy, but we haven't been as intentional about when and how we use our voice. And that is something that we will be looking to do. We've had a board staff work group that has been engaged in this work since the beginning of the year to try and identify how and when we want to use our voice and what we can do to achieve our goals. And to think about how we want to engage in policy and advocacy. It's here, and many of you are already engaged in that work, but how can we also be intentional? And then, of course, all of this is built on making sure we have a strong, high-functioning organization to do our work. And speaking of that organization, as you know, we have a great team of people that I work with who I've been really fortunate for these past 2 years to learn from and grow with as I've been engaged in this work. And so I'm going to ask our team to stand up so that you know them, because many of you do. They are the resources. They are all wearing red lanyards. Oh, I took mine off. But if you see them, this is the team that does all the work. And as you all know, none of these conferences happen without a lot of work, a lot of nights. And I want to call out 2 people in particular who are hiding in the back. But Sue Palm, who you know as our meeting manager, who is the one making sure that everything is perfect, and my partner in crime, Osula Rushing. We also have a great board that is committed to our goals and our vision. And so I want to briefly ask them, whoops, I went the wrong way, green button. I want to ask them to just stand so you get to see them as well. We have been very fortunate to have a board that is supporting our goals and our vision and really working to help us. And so you'll see them around. If you have questions about where we're going, feel free to stop any of us. So now I want to turn our attention briefly to what's ahead of us in this week. Again, we are so excited. It is an inflection point for health philanthropy and for all of us in the country. We have put on the plenary stage a number of key issues that we think are timely as well as important ones for us to delve into. We have breakout sessions and work groups, networking sessions, opportunities to really dig in, to hear from each of you as well as other experts in these fields. We always are excited to welcome and acknowledge our award winners, and you'll see for our Andy Hyman Award and our Terrence Keenan Award, our winners, and we'll hear from them. And then we will close out our conference with a strategy session on advancing LGBTQI+ health equity. You'll also note we added a networking session on Wednesday morning for funders who are interested in advancing access to healthcare, reproductive health care. But the main thing that we want you to do is to reconnect with each other and re-engage in the work that we have ahead of us. We have over 600 people who are here attending and participating in the conference, for representing 238 organizations. 500 of you all are here in person, although that number is going down given the airfare issues that we're having. 127 are participating virtually. We have people who largely are program staff, trustees, executives, vice presidents, and 178 different speakers that are here. And we're so excited that so many of you brought your friends and colleagues. So we have 198 organizations with 1 to 3 individuals. 28 of you brought 4 to 7 of your colleagues. 12 have 8 or more. And where is Dwayne from the Missouri Foundation? Gold star. 21 attendees here from the Missouri Foundation. So with that, I want to dive into the meat of the work that we're doing and get to hearing from our experts. And I'm really excited to bring to the stage 4 leaders in the philanthropic space. And you know them well, but I will just take a moment because I'm going to say that I'm going to just read their titles. You have their bios. You know who they are. But invite them to join me. I have Bob Ross, who is the president and CEO of the California Endowment. Drew Altman, president and CEO, and my former boss from the Kaiser Family Foundation. Francis Padilla, president of the Universal Healthcare Foundation of Connecticut, and Kiana Thompson, president and CEO of the Health Forward Foundation, and one of our board members. If you'd join me up on stage, we'll dig into a conversation. Welcome to each of you. We have some time. We have a lot of ground to cover. We are not going to cover it all, so we'll consider this a start of a conversation. We are going to tee you guys up for questions, so those of you who are joining us virtually, please feel free to send yours in. We have Sue and Osula in the back who are going to be bringing those to us, and we are going to have microphones around here for those of you here in the room. But let's dig in here. So, philanthropy's evolution. It's been 40 years of GIH, and what have we done well, and where do we need to go from here is kind of the short, easy question to start off with. So, what have been some of our successes? And maybe Francis, I'll start with you.
Okay. Well, I think in 40 years to have an organization that has really brought philanthropy together on a consistent basis is really a remarkable thing. And there has always been a focus on strategy. What are we doing? How can we be more strategic? I think that over the 40 years, there's been many, many challenges. I think there have been some really good successes. And in the time that I've been involved, which hasn't been 40 years, in health philanthropy, but I have been involved in philanthropy for 40 years in and around it. And I have seen the health philanthropic community really come together around the issues of health equity. I think that it really has been a leader in the field of philanthropy, naming equity as an important and critical issue to advance in all that we do. I think with the Affordable Care Act, our field really stepped up. When in 2008 and 2009, it became clear that there was going to be something major for the first time. Our field mobilized, our field got our states and our communities ready, and then with the implementation, I feel that we were there as supports where the federal government didn't quite step up. We were able to provide the navigation, the assister support, the evaluation of the initial rollout to figure out how to make it better. And COVID, obviously, we stepped up in many, many different ways. So there have been quite a lot of successes, I feel.
Yeah. What, others? You're on.
I have a list. Yeah, thanks, Francis. And I would agree. I think, I'm 21 years in, so I have a 2-decade kind of view on this. So the key themes that I recall when I entered health philanthropy were these 6 things: care and access, data, research, knowledge, innovation, and pilots as the route to impact. 2, social determinants and root causes, more equity and inequities, more race, much more race, more place, more policy and systems change, and more advocacy and power, right? It's kind of the to to from. I would agree that we did, as a field, I was really proud of how we in health philanthropy showed up during the ACA. I think a lot of those tens of millions of people who had coverage pre and post was in large part, significant part, contribution, not attribution, but a significant part played by health philanthropy, BU, at the Community Foundation, regional, state, national. We all had something to sort of lean into with ACA, and I think we did it well, based on local politics and local realities. And some of that work, particularly with Medi-Cal expansion, Medicaid expansion, is still going on. What we need to do better and next is, while I think the ACA was a defining moment for health philanthropy in the nation, we just had our defining moment revealed to us last week with the dismantling of Roe v. Wade and the Dobbs case. And what we do as a field as a result of that enraging and disturbing development, I think will test our mettle for the next several years, because this is not just isolated, and we all know this, to reproductive rights and women. This is a much bigger issue than even just reproductive rights. And we've already had Supreme Court justices thinking out loud about what's next with the slippery slope. And that's going to be harder than the ACA, because the ACA gave us something to work from. We kind of knew what the roadmap was. This is what the law says. This is who's eligible. This is what happens. Help people implement it. What we're dealing with now is tougher than that. And I'll have the answer to that later.
Well, you've got a little bit of time to think on that. But, when we think about that, that's a good segue. So obviously, we are all thinking about what happened last week. And even, we're talking about Friday, but Thursday was big too. And that's been kind of drowned out a little bit. So what should philanthropy's role be with regards to policy and advocacy? Because I think that we have tried over time to avoid some of that, generally speaking, but where should we be in this moment and going forward?
I think to answer that question, we first need to take a step back and ask ourselves, who are we, right, as a field? Why do we exist as health philanthropy? And more importantly, what is our purpose in view of contemporary conditions? And for me, it brings to mind a manuscript that Martin Luther King Jr. penned in 1967 in a Birmingham jail cell, titled, "Where Do We Go From Here? Chaos or Community?" And in that manuscript, in really illustrating how really goodwill, good-natured folks like us in philanthropy, how they were incensed by the brutality that was experienced in Selma. He noted that the conscience of man flames high in the hours of peril. And that has really been resonating in my ears for the past several days, for the past 2.5 years, but more poignantly the past few days. Because in view of our massive resources, right, our influence on policy, I think it's time to really take a step back and ask ourselves, what is the highest and best use of philanthropic resources? And I would hope that that question causes our flame to burn high in this moment. And actually, I hope it's lit, as the young folks say, honestly. I really do. Because it's time to shake up some things. It's time to change some things. It's time to make bolder, riskier moves. And I don't see how we can do that in a systemic way that is addressing systemic change without levering policy and advocacy. I don't know that it's possible.
Drew? I can count. First of all, I couldn't improve on that statement. Thank you very much for saying that. Some of you have heard this. Once when I was in government, I was described as a nice guy trapped in a deadly serious face. So, I mean, we're not a foundation anymore. Thank you so much for inviting me back into the flock. You probably should have gotten rid of me. I want to go back to talk about how we're prepared to take on the challenge that we're all talking about now, because it is really a very serious moment for the country. Well, it makes me a little sick to say it. 40 years ago, I was a vice president of the Robert Wood Johnson Foundation.
Just out of high school.
Yeah, pretty much. It was just such a different time. In that era, there were a much smaller number of health foundations, mostly big East Coast health foundations. They were largely an attachment to academia. There's a famous story about a dean at Harvard Medical School named Bob Ebert, and everyone kept trying to get him to take foundation presidencies, and his line was, "Just stop asking me. Foundation presidencies are jobs you take after you're dead." And you know what? Then he wasn't wrong. Then the Pew Charitable Trust, the powerful Pew Charitable Trust, was a subsidiary of a bank in Philadelphia that made its grants anonymously and didn't have a listed telephone number. When I founded our organization, KFF, and announced what we would be doing, information in real time, aimed at the national agenda and policy and dealing with legislation, 2 days later, I received a note from the then Dean of Health Foundation Presidents, a close friend, on her beautiful gold embossed stationery, and I opened it up, and all it said was, "Dear Drew, you will drag us down and destroy us all." Okay, now we are all, the entire field is fully engaged in all of the issues that you and we have been talking about. The leaders of health foundations are remarkable people. They're not dead. Who I would put up against are more talented in many ways than the very top leaders in corporations and in government, some of whom, we all admire. And they don't all look like Bob Ebert. And if Bob Ebert showed up today and was interested in being the CEO of a health foundation, we would probably say, he was actually a really good guy, we would probably say, well, you're just not that interesting to us. So the field has changed tremendously and in incredibly positive ways. And if you know me, I'm not always this positive. And so it does prepare us for this critical moment at this dark time to take on strategically the challenges that we now face. And the last 40 years, to me, are an incredibly positive story.
So I'd like to pile on. I think we have been out front, but we've been very careful. And, you said earlier in your comments, Kara, that as a membership organization, we have all kinds of foundations from all over the country. We have been present. What this moment calls for is much more standing up and speaking out, taking a stand, whether it is at the individual foundation level or it is as a national community. This is wrong. What is happening, what happened last week, what continues to happen, all of the falling dominoes that are yet to be seen, that we have been, we are aware that what happened with Roe is really just opening the door to contraceptive access, to revisiting gay marriage, same-sex marriage, to all of the different ways in which we are going backwards, and in which, frankly, people of color, Black, brown, and other people of color, low-income people, moderate-income people in this country, are going to be left marginalized, more marginalized. We need to say to government, no, this can't happen. We need to support the organizations on the ground with sustainable funding. And we, someone said this morning at the CEO working meeting on coverage, we've got to have a long game. I'm reminded of a Stanford Social Innovation Review article of some years ago where they compared progressive philanthropy and conservative philanthropy. And conservative philanthropy has a long game. Funds organizing across issue areas so that organizations can pivot in a nimble way. Progressive philanthropy silos the issues. You get funded to work on children's issues. You get funded to work on issues around AIDS. You get funded in such silos that you build no capacity to really go across. And there's no organizing infrastructure in most places. Some places are better than others, but grassroots organizing, building a demand, power concedes nothing without a demand. It never did, and it never will, Frederick Douglass told us. And those words have been ringing in my mind over the last few weeks. And I think that the field, it is our way of repairing. Reparations is to build power.
That's right.
Use our resources to build power.
Right. That's right. And
Yeah, so let me, and I want to channel, Kiana invoked Martin Luther King, and Francis just went to the punchline here, which is power. That's it, right? So California Endowment, we spent 10 years in a Building Healthy Communities campaign that ran from 2010 to 2020. The next 10 years of work is sort of learning from that experience, but I'm gonna give you for free in 2 minutes what it took us $1.5 billion to learn from that 10 years. The surest path to community wellness, and what we did differently is we went away from the silos, Francis, and dropped anchor in communities, in neighborhoods.
Yeah.
And tried to, as best we could, channel the experiences and wisdom of those most impacted by inequities in those neighborhoods to inform our grant-making strategies. Wasn't easy, but we did our best with that. And we have 10 years, and if you want stories, I can give you stories. If you want case studies, I can give you case studies. If you want numbers, I can give you numbers on policy wins and system change wins, which numbered more than 1,000, by the way, in 14 healthy community sites. The punchline there is the surest path to community wellness for all. You had for all in the GIH strategy, and when Kiana mentioned Martin Luther King, that's a positive for all vision, right? That was Martin Luther King followed by John Lewis, the beloved community, right? Google the beloved community and you see how Dr. Martin Luther King describes it, and that's what most of us, if not all of us, are about at the end of the day. And what does for all look like in real time? But what we learned for that $1.5 billion and the case studies and all the learnings we did was the surest path to community wellness is through a robust, inclusive, participatory democracy. Period. Full stop, end of paragraph. Okay? You can get as cute as you want about, bold innovations and new killer apps and all that stuff. All that stuff is fine. I'm urinating on the importance of innovation. But the thing we've got to learn is we've got to take innovation for innovation's sake off the altar of philanthropy and put power at the center of it.
Yes.
That's what this is about. You saw how long it took us to get to the ACA. That wasn't a data problem. That was a power issue. You saw what happened last week. That's not a data problem. That's not an innovation problem. That's a power problem, right? And so the faster most of us sort of begin to kind of grasp that in context, because some of you are in red states and some of you are in bluer states, and it's in context, right? I'm not asking you to commit harry-carry, right, politically in your own communities. But if you don't get what Francis just said, that this is fundamentally about who can play the democracy game better and who can rally more folks with organizing and advocacy investments that assert a fully inclusive participatory democracy, and I'll end on this, that centers the experiences of the most marginalized, the most oppressed. If you follow that script, we will have success. It's a long game. It's not a short game. It's not a 2-year grant strategy. Okay? But that's my $1.5 billion lesson to share with all of you. Well, you're not getting it for free because you had to pay for the conference, but whatever that cost was, you got it.
And we actually have drawn the same lesson. Of course, we work more at the national level. And we produce information which sounds very dry and researchy, but that's actually not what we see ourselves doing at all. What we see that is as a vehicle for amplifying the voices of the very same marginalized groups that you're talking about. That's why we do the policy analysis. That's why we do the journalism. That's why we do the polling. Because my view of the healthcare system, the whole reason I set up KFF, is because I view the health system as a broken system dominated by money and politics in which people do not have a voice. And so what may look very technical and very researchy and, oh, it's just information to you, is actually a strategy. We need similar strategies when we work at the higher levels of policy to do what Bob's talking about. Just as we need strategies at the state level and at the local level as well. At this point, you know, we are fond of talking about COVID is a public health crisis, and racism is a public health crisis, and gun violence is a public health crisis. The broken political system is the biggest public health crisis because we can't solve our problems unless, as health foundations, we wake up and address that. That doesn't mean we all have to run off and lobby or, as Bob said, commit political suicide in our states. That can be done by supporting local journalism that helps hold government accountable and amplifies the voices of people. That can be done by supporting community organizations. That can be done by supporting legal services organizations. That can be done by supporting data, which, and I don't want to go on, leads me to the other big thing I'm worried about, which is the erosion of trust in data and experts and institutions, and what to do about that, which is the big thing that I and we are working on right now. But this is true at the national level as well as at the state and local level.
I wanted to chime in briefly, and I'm so happy, Francis, you turned the conversation here, and Dr. Ross has punctuated with respect to power. And I want to thank Dr. Ross and the Cowan Dow team, because so many of us have learned from your work with respect to power building in communities. So thank you for that. Our communities are under siege, right? The health injustices are rampant. Their human rights, civil rights, health rights, medical rights are under attack. Our democracy is unraveling before our very eyes in ways that we never thought we'd see. I think we felt comfortable that we would continue to progressively make change and not have an unraveling of rights, right, that we've all enjoyed for so many years. And when I think about what's happening, I really need to communicate the importance of discontinuing programming this thing to death. Like, programs are fixing people, and people have never been broken. They've never been broken. It's our systems, it's our structures that are broken. And so I get that we're all different. I get that we're not a monolith. We all have different focus areas and paths. But we cannot program our way to health change and to health justice. We just simply can't do that. And so as we think about how we move forward, I think we need to think systemically about how, whatever your focus area is, what's the upstream action to that? And how might that be used to dismantle and uproot systems and policies that keep our communities unwell? And how might we seed and plant systems, structures, and policies that position our communities to thrive and have holistic agency?
I would tag on to that, I would pile on to that, Kiana, that it feels to me like we need to build public will for the policy changes that need to happen, and we need to build political accountability. The political accountability comes from that public will. And the data are very important. The polling is extremely important. And on so many levels, the people are ahead of the leaders.
That's right.
And yet, we see the kinds of decisions, the kinds of policies that are being enacted. And what happened with Roe, what happens with guns, what happens with immigrant coverage, is all really, the American public is further along than the white male-dominated Congress and state legislatures. And so it feels to me like our field can take this research, can take the data and use it for real transformative thinking, community conversation, community action. Take it to legislators and to Congress and to the Senate, but also take it to the people, break it down in ways that folks can use it, because it's the lived experience, and then they can see that their lived experience doesn't mean that they're broken. It means that the system is broken because the data show it, right? And then go. And we need to get people, I know we're all, we're not in the political realm, certainly not in the partisan realm, but unless we do something about new leadership in elected office, the democracy is in peril, and it will remain that way. There does need to be attention, and many of us can't go anywhere near that, but there are other organizations that can, with whom we ought to be in partnership to move the needle on who is the next generation of elected leaders at local, state, and national levels. That's when we're going to get health.
So,
Can I just interject a moment of optimism about something? Because we do a lot of the polling and studying the polling about the midterms, with the caveat that it's early to look at polling about midterms, particularly around Roe and around guns. And so midterms are not general elections, and they're about turnout. They are therefore a game of inches. And so small changes can make a big difference. And if you look at what we're seeing in the polling, and if you look at where younger Americans are, and in particular younger voters, women, and especially younger women, Republican women in the suburbs, yeah, it's going to be about inflation and gas prices. But if there can just be an incremental change, if the right efforts are made to mobilize those groups at the margin. Certainly the 100-foot wave could be 40, and there actually could be a serious difference made at the margin. You know, it's race by race, but at the margin in the midterm. So guardedly, I am more optimistic about that, but it depends on what is done. It depends on what is done by all of us, and it certainly depends on how this is handled by the Democratic Party. If they're successful at painting the opposition as radicals, if they abandon their 38-point plans about everything and actually communicate effectively, they could make a difference.
Yeah.
This is good. My job is only, as I said, I'll just say start and then we'll stop. I'm going to interject for just a second, and then we're going to come back to this.
Go ahead.
Right. So I'm going to start queuing up people. I'm going to ask one more question, maybe, or we'll just have the conversation keep going. And I'm going to ask people if you have a question. We have some microphones. If you're virtually participating, send your questions in. We'll try and integrate those in. And I'll let you make your comment, and then we'll sort of pivot maybe to thinking about how do we, particularly, this is a health funders conference, and what you guys have all just said is we need to be focused on democracy and voter participation and engaging elected leaders. And so I know
your question is?
Some people are probably wondering, you know, how do they behave? Right.
Yeah. So, you know, I'm in California, the bluest of the blue, and let me just tee off what one of my colleagues, and Francis, you made a comment about polling. So, and I know just in the CEO's meeting this morning, which was kind of sobering, more than kind of sobering. We should have been gleeful for being together again, but the Supreme Court decision was in the room, really heavy with CEOs. But even in California, so here's what happened this past year in legislative session. There was a bill to move single payer forward as a California play, and it died. And it died in committee. It died in health committee, and in a legislature dominated by Democrats, dominated by progressive Democrats, in a committee run by progressive Democrats, with a governor who campaigned in support of single payer. And it died. And it died because the polling said that 60% plus of Californians would agree with a single payer or single payer-like system, but it couldn't get out of committee. All right? Once again, it's not that we need yet another analysis, rigorous analysis from Rand or from Harvard or from UCLA to show why in other nations a single-payer approach is better. So again, even in California, that gap between what we know is best for communities and what works for our nation and getting it done is significant. The second observation here has to do with I'm going to throw out something that this is not from any rigorous analysis. This is just sort of Bob's 2 cents at this point in terms of what's missing, because I think we agree we need more of a policy mindset, advocacy mindset. We're funding more organizing, more base building, more advocacy, more grassroots, more of that. All that's good. I think where we're at now in terms of the nation, Cara, I think we need to be a bit more intentional and diligent and strategic and impactful about the faith community. I don't think we get past this red-blue thing that's got our nation so effed up right now without the faith community playing some meaningfully significant role. And it shows up over and over and over again, and it showed up big time in 2016 and not in a way that helped us. So I don't know what the answer is to that. I don't even know what the grant looks like. I'm just saying some kind of relationship between health philanthropy and the faith community. Some of you already have that now in your local, or it's probably, I would say the regionals are probably better at this than sort of we are as a statewide foundation, or even the nationals. But I think there's a key here with the faith community that we just need to be more strategic and thoughtful about and mindful about, because I think that's how we break through the mess we're in.
So breaking through the mess that we're in, building this, what are the top, like, 2 to 3 things we need to do coming out of this to build that long game, to focus on the change that we're trying to do across, the myriad of ways people engage in this work, and thinking about some of those different perspectives at that national, state, regional, those who are in services, those who can do more of the, general operating support. Like, what is your advice to your colleagues here? If we came out of here collectively and focused on these 3 things, we'd be having a different conversation at GIH's 50th.
Well,
I'll throw out one: integrated voter engagement with a health lens.
I'm having a hard time hearing. I'm not sure if you all are. But
I didn't catch what you said.
Yeah, integrated voter
engagement.
Voter engagement. So, did you want to pile on?
Quickly, I think our undergirding mindset needs to be that of power, right? Which is the ability to change the rules. That's all power means. And for us, we are focusing on racial equity and economically just systems. Because when you boil down health inequity, those are the cross-cutting factors. Not race, but racism, and the fact that folks don't have the assets that they need to be healthy. And so those are the 2 factors that I think are the most important through a systemic change lens.
So for us, we have decided we're going to focus on building an ecosystem for organizing or strengthening the ecosystem that exists and building it out, working in collaboration with a cross-section of organizations, including other funders who may or may not want to come along, but other funders outside of health, so that the issues are really issues of justice and that they're bound together by a commitment to anti-racism. And I think if we do that for long enough, we will build power on the ground that will manifest itself in voter engagement and will also manifest itself in demanding the kinds of health policy changes that people need and want.
Our big play is journalism and local journalism. We now run the largest health newsroom in the country. We just launched a Southern Bureau, which will have a presence in every southern state. The choice of the South is not an accident. To bring critical information to people and help drive the agenda in those states and hold those governments as accountable as we can. But to me, the point of this discussion is, sorry, there is no one thing.
Right.
The obligation is for everyone to get off the bean counting and the metrics, have a strategy. I don't like venture capitalists. I live in the middle of them in the Silicon Valley. But one of the things I've learned about them that I do kind of think is right for now is basically they look for leaders who have a strategy and a team, and that's it. And I think that's where we are right now, and kind of get out of their way.
Yeah, and I'll just say, can you hear me better now?
We'll have a conversation
Okay.
after this.
So-
I'm going
so
to
just
invite,
one more-
if anybody has a question, there's a microphone there, and I'm
come on
going to
up.
invite you to go while you're making that.
So when we did the Building Healthy Communities work, we made a lot of mistakes early on. I did one thing right, one thing. I asked the board for 10 years.
Yeah.
Let's let that sit for a minute, okay? This is, remember the scene in The Matrix when Lawrence Fishburne offers Neo, Keanu Reeves, the red pill or the blue pill? Like, you could take the blue pill and be happy with this authoritarian controlled state, or you could take the red pill and kind of liberate your mind to like obey you're crazy, right? Obey you're crazy. It's a 10-year thing. You can't go down this path for a year or two. You just can't. You can't. If building healthy communities had been a 3-year initiative instead of a 10-year initiative, we would have pulled the plug on it in 3 years. Trust me. The community started putting points on the scoreboard at year 3, 5, 7, and then we were rushed with victories across the state. And so take the red pill, take the plunge with your boards. That's the conversation you got to have.
Okay. Got a question here. And if you could identify yourself, because all we see is the lights.
Oh, you can't see the bald head, the glistening on the head
I recognize
there?
that voice,
we
though,
got
but
you,
go
we got
ahead.
My name is Eric Kelly. I'm president of Quantum Foundation, right up here in Palm Beach County, or yeah, right up there. I was recently reading an article, the Milbank Memorial Fund. They acknowledged their insidious and hideous role in the Tuskegee syphilis study. This is a question for myself, but I hope y'all can help me with this. Truth and reconciliation. Does our field need a moment for truth and reconciliation? Because we're talking about equity, we're talking about doing good, but should there be repentance before we move forward? I see it as a man who enters into a home, murders a family, and with the blood of the family on his hands, reaches out to the sole child left and say, I'm here to help you, but I have the blood of your relatives on my hands. So do we need a moment for truth and reconciliation?
Well, Eric, last night you told me you stopped preaching, and I don't believe that's the case. I just passed the collection plate. Yes, we do. One of our partners, the Ad Hoc Group Against Crime in Kansas City, has been talking with us about that in terms of healing and reconciliation. Because the fact of the matter is that many communities, particularly the Black community, has moved on to liberation, and we're still talking about equity, right? When we haven't even done the healing and the reconciliation and the acknowledgement. And I think in doing that, we have to own that philanthropy has very much been cloaked and shaped in white, wealth, dominant culture, practices, and mindsets that has caused us to be deeply entrenched with our power, with our privilege, with racist practices, and judgment, a lot of judgment. And so I think we have to first spend time decomposing and examining all of those practices and mindsets that have shaped philanthropy and asking ourselves, how does racism show up here in our processes? And there's a lot of board and staff work that has to accompany that process, a lot, right? And I don't think it ever ends because we're microcosms. We're swimming in this. And so we have to do just as much work and apply just as much intention, which takes years, to just get to that space of healing and reconciliation while we also concurrently work to listen to communities and build what they say they need in from an equity standpoint.
So, I'm sorry, I would agree, and we have had organizers say to us, Universal Healthcare Foundation, philanthropy is the problem. Philanthropy has created the silos. Philanthropy is using resources that really were garnered by the robber barons to fix problems that those folks created. And there is a certain internal body of work that needs to happen and a willingness actually to share power in a totally different way, including, and I'm putting this out not necessarily because I agree entirely, that, but including spending down resources by investing those resources into the communities that need the resources. And I said earlier that reparations, the power is actually philanthropy's challenge for reparation. It comes, though, we can't do the external work of building health, creating communities that are healthy, if we don't do the internal work at both our governance and our staff levels. We have to take that work seriously, Eric, internally, externally, and simultaneously on an ongoing basis.
Yeah, I just want to say, because, brother, I'm glad you asked that question. The margin between moral righteousness and political foolishness is razor thin right now. Okay? So, yeah, but this is why I went to the faith community, because of the question you just asked. Okay? Because look what critical race theory and defund the police have given us, particularly for those of you in red states. Okay? So the answer is absolutely, I agree with that, brother, but in the context of your political reality and dynamics that you're dealing with at a foundation level, right? Because it's so easy these days to not only be marginalized, be attacked. And all of a sudden, you and your board are fighting a whole different kind of battle, right? So yeah, but that's part of the reason why I think the faith community engagement is going to be critical, because I don't know how, in California we can get away with it. If you're in Alabama, I don't know how you get to that conversation without the faith community. I don't live in Alabama. Somebody from Alabama can tell me whether that's possible. Louisiana can tell me whether that's possible. But that's an example of why I mentioned the faith community as being important.
So we got a long line here and not a heck of a lot of time. So we have that one. I'm going to come to you in just a second. So this is good. So we have one of our questions from a virtual participant. GIH has always been a big tent. We have people from all over the country representing all sorts of organizations. So what are we saying to them who may not agree with this? What is the message we're giving our peers as we chart our path forward here?
When you say this,
Well, so we've had a very frank conversation that we need to share power, we need to move democracy, we need to center equity. Those terms, racism and some of that, having done some rural work, that doesn't play well all the time. We talked a little bit about that, health equity doesn't always play well. So how do we move forward collectively and in a way that helps us all sort of move towards that goal of better health for all through better philanthropy?
well, red state, blue state, purple state, we're serving 2 red states, Missouri and Kansas, in the region. I think our allegiance needs to be to health and not to politics. And when we look at, or partisanship, when we look at the data, which includes the lived experience of our communities, it's clear that civic engagement, participation in democracy is the newest social determinant of health. That's clear. Mm-hmm. When people are more educated, engaged, and activated in their community, and of course we know that translates at the federal level, they are equipped with agency. And there is a corresponding improvement in how they manage their lives, their access to means and resources through their agency as well. And so we need to look at civic engagement as the new super social determinant of health. And there's data on this, right? If you're focused on the written word, GIH has put out some data on this, and there's other white papers that we've been reviewing with our board around civic engagement and its relationship to health outcomes. And so look at the data.
Thank you. Okay.
This has been great. Stephen E. Smith here, trustee board chair for the Health Forward Foundation in Kansas City. That's right. Shout out to Kiana. Kiana, you talked about some key words. I mean, all of you all have been throwing out some really key words, but I'm curious about the other foundations, and maybe Kiana, you can share a little bit of our story. But what is the common language and the shared perspective that is really driving you all's work? I mean, we know that depending on your various dimensions of diversity, different things mean different things to different people. And so how and what is grounding this collective impact that is coming? And so curious about that. And then just my commentary about, I'm not sure if honoring the old political game gets us to where we want to be. And so just curious about what that breakthrough looks like so we can get different outcomes. So what is your common language and shared perspective, and how might you advise us in playing a different political game so that we can have a different outcome?
Well, at Health Forward, we understood, first we determined that racial equity would be one of our pathways to health equity early in 2020 before the pandemic hit. And I think we intended probably a much more measured pace, right? And then that was a wrap. And in that process, we had to take time to develop shared understanding and develop a common understanding of the systemic analysis of economic and racial injustice, and looking at all the sectors, right? Finance, education, health and human services, banking, all these industries, and sit with how philanthropy has contributed. And so I think taking time to really understand that health equity is shaped by changing the conditions of the communities we serve, not the people, but the conditions. And so we've taken some time to bring our board and staff along, have done the same thing with staff, around that shared language and common understanding that is translating to our work. But it's been deeply and intensely and rigorously internal for 2.5 years.
So there was one more virtual question that we got, which I think is one that a lot of people are feeling now. So we've talked about we need a long game, and we get that the work that what has happened has been a long game. But for those wanting to do something right now, storm the castle, whatever that may be, what should we be thinking about in the reaction of the immediacy of what's happened recently? How do we move forward in the now as we're building that long game?
Yeah, I mean, I would say if you're investing, and I'm channeling my colleagues here, if you're investing in organizing and advocacy and infrastructure for movement builders at the community level, do more. And if you're not, start. Voter engagement, and when I say voter engagement, I don't mean the kind of voter engagement where people show up knocking at the door 6 weeks before the election and go away. When I say integrated voter engagement, that's where voter engagement meets community organizing. It's a more durable, anchored, integrated voter engagement strategy. And we will know, we'll know this November whether there has been a reaction to Roe v. Wade. It won't take us 10 years to figure that out. We'll know in November, okay? But that doesn't happen by itself, and that doesn't mean we're asking folks to get partisan. You know, we know that there's a relationship between civic engagement and community wellness. So fund integrated voter engagement as a community wellness initiative, as a civic participation initiative, right, which is what we do. So, and then the last thing, the second part of the last person's question, young people. Young people, young people, young people.
I agree, and I think I would just add that there's another role that we can play, and it is to engage people in dialogue across difference. There's some interesting work happening at the national level that the RX Foundation, Jenny Riley is in the audience here, exposed a number of funders to recently, where people who are identified as white nationalists in their thinking are being interviewed about what they feel are the problems. And one of the results of that extensive work in 8 or 9 states so far is that there's no trust in government. Absolutely no trust in government, can't be bothered. So the civic engagement part doesn't work for them because they've opted out. The other is that in terms of why they think they are experiencing economic problems, social problems, their responses are anti-everything, anti-black, anti-woman, anti-immigrant. And so we are in a space right now as a country where there is so much divide between people. And it doesn't matter if you're a national foundation or a statewide foundation or a local community foundation, there is such a divide. And I still feel, back to your comment about the faith community, Bob, I actually think that partnership with the faith communities around dialogue. I come from a very activist foundation. When I talk about we need to promote conversation and dialogue, people sort of glaze over at me because they feel like, no, wait a minute, what's the call to action? And I say, well, you can't have a call to action until people actually understand one another. And there's an accurate diagnosis of the problem. And so I think philanthropy is really well positioned to advance this. This is the fabric of the country, and it's very frayed.
I just make a note about the importance of not completely forgetting the big things that will be happening at the national health policy level that will fundamentally affect people. As the public health emergency winds down and millions of people fall off of Medicaid, what happens with the ACA subsidies, which just in California affects millions of people, whether there is or isn't drug price negotiation, which is important because of the cost of drugs, but for finally establishing an anchor for dealing with prices, which is the single biggest issue we face in healthcare costs. All of these things affect people's economic security, whether they can put food on the table, and the big things people worry about that determines whether they care about health when they go to vote or they don't think about health when they go to vote. So you all have delegations that you're in touch with. All of this critical stuff is unfolding, and while we work at all levels on these issues, I have always thought about our work on the ACA, our work on Medicaid, our work on all of these issues as work on deeper issues. Otherwise, frankly, it would bore me to death. So I suggest we all do, and it is not the only thing you should be working on, but one thing you should be thinking about. Tens of millions of people will be affected by how these decisions are made, or if they're made or not made.
And I'll give you the last word as we wrap up here.
One of the questions that I saw on this monitor here was around collective impact and how do we view that in the context of this conversation. And I think so many of us feel like this can't be done, and because I think the question was around a red state. This can be done even in red states. You gotta believe that you can make a change. If you don't believe that in a red state, then you've X'd yourself out. Health Forward led the initiative to get Medicaid expansion passed and was joined by over 300 cross-sector organizations, including our partners here in the room with Deaconess and Missouri Foundation for Health. The faith community was heavily engaged. We had our chambers of commerce heavily engaged. We had grassroots, game was tight at that level. And so this can be done. It's about our will, our belief and truly transferring and sharing our power with the community, because the community always knows what it needs. We got that done. They're still fighting us in Missouri. It's safeguarded for now. But this can be done in red states. So just think about whatever that issue is for you and start from a place of belief in yourself and belief in your communities.
Amen.
Well, I'm not going to add anything to that because I think that is a great way. We are going to pivot because people want to keep the conversations going in other spaces. I invite you to join us for our workshops that are coming up in a few minutes, as well as our next plenary this afternoon in terms of advancing equitable quality care for people with serious illness, and our opening reception, and to join us for our screening and discussion of Ken Burns' new documentary, Hiding in Plain Sight. I want to thank Kiana, Francis, Drew, and Bob for kicking us off with an excellent conversation. I hope you enjoy the rest of the conference. Please come up and say hello. I'd love to get to know you all over the course of the next few days, and good luck. Thank you.